Look, I wanted to pick your brain because there's something that hasn't come up yet, which is the importance of dentistry and how many people are getting sick from all these bizarre things that people put in their mouths. I mean, Abs, if you could let us know how you came to this and a little bit about your history and what you think is wrong with dentistry and all these ridiculous things. What, you know, for example, root canals, are they as bad as people think? But get into that. And
yeah, so I originally did dentistry, as you know, and then I noticed that we get taught in dentistry that if you brush your teeth in this way, then you have no problems. And that I can tell you hand on heart, that's exactly what is taught in dental school all around the world, everywhere. But even when I was a dental student, you know, I would see patients whose mouths were full of plaque. And the textbook says if you have that, then you have lots of tooth decay everywhere. But there were patients with plaque everywhere and zero decay, zero gum disease. And I just did not understand. And I asked, you know, my tutors, how is this happening? Either they didn't have an answer or they as good as told me to just shut up, basically. But then I would see other patients who were really motivated and who really were interested in looking after themselves, and they listened to everything we said. They were the textbook patient. They followed the right brushing technique, they followed the right advice, they followed the right diet advice, and yet they would come back with non-responsive gum disease and non-responsive tooth decay, and every single time we saw them, things either stayed bad or got worse, even though they followed the advice that we are trained medically to give. And it made no sense to me. But also at the time, I didn't really have that much knowledge because I actually wasn't that interested in dentistry at that point when I was a student, because I hated the way we were taught, just death by PowerPoint. So then I got into practice and I started seeing similar things. And then I had a couple of patients who, for a long time, had pretty bad gum disease, which if you don't control, you are going to lose your teeth and it will have a massive impact on the rest of your body. And we tried all sorts. I tried the textbook treatments, and then the textbook says, well, this is what dentists get taught. So you do your, what we call non-surgical therapy, which is in the clinic, which is what your dentist probably would have done if you were in that situation. If you're non-responsive as a patient, you then get sent down a referral pathway to basically a gum specialist who then tries to treat those gums surgically. And I sent patients down that pathway because I did exactly what I thought was the right thing, listening to the textbook. But then those patients would come back to me and they were still none the better. These diseases just still kept carrying on. And a couple of times in my career, I had 2 patients that came back, and without me doing anything, their gum disease just disappeared, or almost disappeared. And I hadn't done anything, I hadn't referred them anywhere, and when I spoke to them, they said, you know, they hadn't done anything. The first one said they went keto. I had no idea what that was. And the second one said they went carnivore. I had no idea what that was either. But I never really paid attention because I thought that's got to be some weird thing over there that no one really pays attention to. And then I started looking into it more and more. That's when I ended up looking at the work of Weston Price, who I still look at now. And I think Sylvie has a book in the corner there called Nutrition and Physical Degeneration. It's honestly one of the most significant books in terms of health and nutrition I think has ever been written. It's definitely one of the best books I've ever read. And when we look down that road, we see that so many diseases that we know today, obviously you guys know, is down to diet. But we also see that the massive link between what's happening in your mouth and the rest of your body. For example, even infection. If you've got bleeding gums, that is an entry point for any bacterial species to go into your entire body. Yes, it's in your mouth, but obviously all your vessels are connected. So if you don't look after what's going on in your mouth, it has a direct effect everywhere else. And again, Weston Price saw this. And so that's when I really got stuck into nutrition, and I started reading more about that. And then I understood more about obesity. And then I started reading into metabolism and reading into mitochondrial function. And, you know, I'm a consultant in biotech research now, specializing in mitochondrial function and metabolism. And it's all connected. And so for me, dentistry is the first step into understanding systemic health, because systemic health stems from what we're eating. And if we don't control what we're eating, the oral health goes first. And that is the canary in a coal mine, if you've ever heard that phrase. And then things start to degrade from there on out. And I'll give you a really specific example. Take diabetes as an example. Diabetes, type 2 is characterized by high glucose levels, high serum glucose levels in the blood. If you've got bleeding gums and you're diabetic, the link between that and gum disease is extraordinarily high in terms of the correlation. Because if your gums are bleeding and the blood that is coming out of your gums has a high level of glucose, what you're doing is creating a permanent buffet for all the bacteria in your mouth. So your bleeding gums are basically feeding the bacteria, which then eat the gums away even more, and then you're going to get even worse control over everything, and it just goes down this vicious circle, or this downward spiral. And so if you don't get a control on one of them at least, you're not really going to improve your systemic health anywhere. And so for me, that's where everything started, and that's how I got into longevity medicine, which is what I do now. It's all the same thing. You're looking at the same thing, which is essentially human health and disease, but from different perspectives. It's all going on in this one glass room, and depending on which side of the room you're looking through, you'll see a different thing, but you're always looking at the same thing, just a different side of it. So dentistry is one aspect, diet is another aspect. Biochemistry, which I think Richard and I are both very, very obsessed with, that's another aspect. You're looking at always the same thing, which is cellular function and loss of function, which is aging, but through different perspectives. And it doesn't matter what your perspective is, because you'll still come across and learn the same thing. You'll come to the same conclusions. So the conclusion that I came to through dentistry and through looking at mitochondria, they were both the same. But one is just a little bit more nerdy than the other, shall we say. So that's how I got here. I think Richard is probably pretty similar in terms of just running with his interest and getting deeper and deeper, right?
An addiction.
Yeah, we're addicted to knowledge.
It's an addiction.
I hope that answers your question.
That's the short version.
That's the short version, yeah.
Surely we don't need all of that. We just need to paint our teeth with fluoride, right?
Yeah, I mean, fluoride is... let me tell you, okay, so in dental school, this is what your dentist actually gets taught. We are taught to recite guidelines. And we are taught that if you go away from the guidelines, and this is not just in dental school, but in medical school as well, we are taught if you go away from the guidelines, you better be prepared to lose your job. Not in that many words, but essentially that's what they say. Now, they tell us, remember students, guidelines are guidelines. They're not rules. There's a difference between rules and guidelines. So sometimes you may stray away, but you have to be prepared to defend yourself in front of a medical counsel if you're going to do that. In other words, you're never going to be able to defend yourself, because you realistically, you will not be able to defend yourself, at least in the dental council. The medical council is slightly different in the UK, but the dental council, I'll tell you this much, the general dental council takes fees from your dentist. They use those fees to hire undercover private investigators to pretend to be patients at your dentist clinic, just so they can catch them out on something. And this isn't fringe or a conspiracy theory. This is published public information. And these medical associations have had to come out and apologize for that. So they're taking registrants' money to try and catch registrants out. It's the most backwards and draconian system that I think of any country in the world. But that's the system we live in. And you have to understand that there are dentists who are good-hearted and well-intentioned, and who do believe in these things, because I've met them, but they will never say it publicly, because they know the wrath with which the council will come down on them to take their license away. So when the dentist says, your toothpaste has to have fluoride, we recommend fluoridation in the water, some dentists will genuinely believe that, because they haven't looked into it, or they have looked into it and they're convinced by it, or whatever it may be. But there will be people that say that, and they're not convinced, but they have to say it because they want to keep their job, and they want to be able to keep their lights on and feed their family. So don't take a dentist or any doctor even, that agrees or disagrees as that being their true opinion. There is an element of, I want to protect my back and not have the regulator come after me. Now with fluoride specifically, like I say, what we're taught on that basis is we must recommend to our patients that they take a fluoride toothpaste, and the legal limit is 1,500 parts per million. And that if it's in a supermarket, it's probably going to be 1,450 parts per million. We must recommend that we are behind fluoridation of the water supply, regardless of whether It is, the concept of taking away consent, because technically you've got no choice. If it's your water supply, it completely gets your consent, which is a big thing for me. You can't take away people's consent. But that is the official position. And if you're at high risk of tooth decay, which would be classed as someone who already has tooth decay or has an inability to keep their brushing ability up, for example, if they have some kind of learning disability and we think they can't clean their teeth properly, that would also be classed as high risk. In that situation, not only would we have to recommend high fluoride toothpaste, but we then have to prescribe a high fluoride toothpaste. And that's not necessarily an option. We don't have to defend that in that situation. What we have to defend is not giving that fluoride. So if someone was to come around and audit my practice, they would see, I'll give you an example. Let's say someone has come in with limited manual dexterity, they have Down syndrome, communication is difficult, self-hygiene is difficult. They're in a high-risk category. It's not that I have to defend giving the toothpaste, the high fluoride toothpaste, which is well above 1,500. It might be something like 2,800 or 5,000. They would ask me, why didn't you prescribe fluoride? So part of the reason it's given is because we'll get in trouble if we don't do that. And when we say get in trouble, the likelihood is you will lose your job, because the smallest thing will lead to someone losing their job in that kind of profession. So fluoride is a contentious topic. I'm personally not convinced. If there is new evidence I've missed, I'll happily have a look at it. I would always be willing to change my mind on anything. But I'm personally not convinced. I don't think it's needed. And also the key is all the studies, and I really do mean all the studies, because I spent over half a decade learning this. All the studies that say it's good, all of them are based on the subject within the study having a standard Western diet. And yet when you go to your dentist, they cannot properly treat you, in my opinion, in the most appropriate way, because they are trained on the scientific basis that the patient sat in their chair is having a standard Western diet. There is no training whatsoever, and I can say it because I've been through it, of treating patients who are not on a standard Western diet. There's no training for patients on vegan diets. There's no training for patients specifically on carnivore diets. And so the ability to treat them appropriately, I don't think is there. And I don't think it ever will be there, because they will not teach things that the typical medical establishment considers as fringe, unfortunately. So, fluoride, I'm not for fluoride, personally. I think if you look after your teeth properly, you'll be fine. I don't have a fluoride toothpaste. I don't drink fluoridated water. And guess what? I have no gum disease and no tooth decay and no teeth problems whatsoever, because I get a free checkup every morning when I look in the mirror. And so fluoride is relative. If there is a scientifically evidence benefit to it in a specific circumstance, it's for that specific circumstance. It's not. I don't think it should be given by default to everyone, specifically if you're on a carnivore diet. Well, because you're not having carbohydrates, you're not feeding the bacteria what they need to produce things like lactic acid in your mouth. That lactic acid in your mouth is what causes the minerals from your teeth to come out through dissolving. And that's when the structure of your teeth gets undermined. And as a result of that, you can develop things like tooth decay. But you're not having those things on a carnivore diet. So how can you possibly give the same advice? Realistically, you can't. But practically, you have to, because otherwise your job is on the line. So I hope that answers your question in a political way.
So this mic needs throwing in a bin. Right.
And you've got awful teeth, so like that.
Can probably see it from there.
My teeth have destroyed the mic. Richard, I'd like to ask you to blow up one other myth as well, and that is, tell people exactly why extended cardio isn't the way to go. I mean, you have the most amazing story, and I'm not going to steal your thunder of it. You can come and listen to Richard tomorrow, but the amount of weight that he lost, proper weight, fat, not the proper stuff, not the bone and muscle. But you've got an amazing story, and I think that you've got a much better idea of exactly what people should be doing exercise-wise and how little. Well, I'd just say 95% of body composition is made in the kitchen, right? Certainly not pounding up in the pavement. What do you reckon?
Yeah, completely agree. You can't out-train a bad diet. I won't give too much away because I want to save a little for the presentation tomorrow, but I was once type 2 diabetic. I suffered with chronic fatigue, depression, anxiety, arthritic pains, daily debilitating migraines that would make me blind. In my mid to late 20s, I was unable to walk up a flight of stairs without stopping or being severely out of breath. And I thought this was normal. My doctor told me that this was normal and that I was going to be on medication for the rest of my days. An incredibly long story short, and we'll get into this tomorrow. I changed my diet. I managed to lose 107 pounds, reversed my diabetes. I became medication-free, depression, anxiety-free. These migraines that I used to suffer with every day that would make me blind. I still suffer with migraines, but now I'll suffer with maybe 1 or 2 migraines each year instead of being every day. 3 medications each day I was on for my migraines. I went on to become a professional athlete. I began training and I became a professional bodybuilder, British and European champion as a professional. As you can see, I'm no longer training for bodybuilding because I'm half the size. And now I've gone into what Phil has alluded to there, which is the long distance endurance stuff. The reason I've done this is because my days in bodybuilding are over. I think I achieved everything that I wanted to. And I wanted to see what was capable and what was achievable from endurance sports. And now I compete in duathlons, running and cycling. But my entire journey of that weight loss, my entire journey towards my bodybuilding career, I did 0 cardio. I would cut for competitions and I would reduce body fat down to 2%, which is not healthy. It's ridiculously low, and I don't encourage any of you to do that, but it was fit for purpose. And that's what enabled me to win these competitions, because I brought a physique to the stage that no one else could match. I had a secret, and my secret was I was a fat burner. So I did 0 cardio. I managed to lose an incredible amount of body fat in order to do that. I now do the cardio. I'm not saying that cardio is healthy. There is a place for it mentally. When we do cardio exercises, endurance exercise, they will increase and release endorphins, which make us feel good. These are compounds, neurotransmitters that we can produce naturally when we are consuming proper nutrients. And this is something I'm getting into tomorrow. It's a big topic in regards to depression, anxiety, and food addiction, which is going to really get into the details in regards to my story and how we produce these neurotransmitters, what blocks these neurotransmitters. But the endurance exercise is fantastic for this, but it's not a caloric model. It isn't a case of calories in versus calories out. A calorie doesn't really exist in the context that you think it does. To put this into perspective, when I was clinically obese and type 2 diabetic, on average I would consume 2,700 calories, predominantly from a carbohydrate-based lifestyle, and I was clinically obese. Now I consume between 4,000 to 6,000 each day, and I'm single-figure body fat without even attempting to do any training. Now, even mentioning about running and cycling, I was speaking to some of the guys earlier this morning. I run 1 to 2 times each week. I cycle as and when I can. My training is incredibly small for the output that I get. So you can't out-train a bad diet. It's not the calories that govern whether you gain or lose weight. Weight gain or weight loss is an endocrine thing. It's to do with our hormones. So each and every one of us knows someone who will say, regardless of what I do, I cannot lose any weight. And we think to ourselves that this person is either lying or they just forget about the quantity of food that they consume. It is undoubtedly the endocrine system that governs whether we gain or lose weight. And this is elicited through the action of insulin. So when we elicit an insulin response, and without to get too technical, this breaks the bonds on the glycerol backbone and sends fatty acids into the fat cell. So what that means is when we elicit an insulin response, the body goes into fat storage mode. In order to burn that body fat, we need insulin to be low. So when insulin is low, it upregulates an enzyme called hormone-sensitive lipase, which breaks these bonds that are stored in the fat cell and releases these fatty acids into the fat cell for us to burn. If you were to wake in the morning, have a high carbohydrate meal, so muesli, for example, which is one of the worst things that you can consume for your breakfast, this will elicit an insulin response, tell your body to store fat, and it will put a biological lock on your fat stores, making it almost impossible to burn body fat. You cannot burn body fat when insulin is elevated. Now, when it comes to muesli, it isn't. To put this into perspective, if you were to consume a bowl of muesli that contained 500 calories, this is going to tell the body to store 5 times more fat than the equivalent of 500 calories from bacon and eggs, because of the insulin response and because of the lectin response. So many in this room will be familiar with lectins. We all know a lectin in the form of gluten, but gluten isn't the only lectin. All grains contain wheat germagglutinin, and all vegetables contain phytohemagglutinin. It elicits a similar response, or the same response but at different levels. And what these will do is they'll bind to insulin receptors, and they'll tell the body to store fat irrespective of caloric value. This is why it's incredibly difficult to lose weight if we eat predominantly vegetable-based lifestyle, particularly from the grains. And we can get well into the details in regards to this. But exercising is not the way forward. We control this through managing our endocrine system. So this means eating highly nutritious food, so proteins and fats. And if we were to look at the average mammalian cell, so every one of us in this room, we're all biologically the same, irrespective of where we come from. We're all biologically the same. And if we were to look at how the cell in each of our bodies is split, it predominates water. 70% of the cells in the body are water. When we take water out of the equation, this drops right down to 18% protein, which is the next highest by weight. The next highest is fat or lipid, and polysaccharide or sugars drop right down to 2%. So only 2% of our cells are made from sugar, yet the average diet predominates carbohydrates. All carbohydrates break down into sugar. So every time we consume something that contains high levels of carbohydrates, this breaks down into sugar, and it'll elicit this insulin response. And we can really get into the detail in regards to training and the impact on cortisol. But cortisol is, and I don't want to go too much because I'm covering this tomorrow also, cortisol we look as being a demon. And the same with insulin. We demonize insulin. These are compounds in the body that are there for a reason. They're there to serve a purpose, and we can't live without them. They're not the demons that they're made out to be. And as Dr. Abbs mentioned earlier in regards to the insulin response and glucose and so on and so forth, insulin is responding to the glucose or the sugar that we are putting into our bodies. Insulin isn't the demon. It's trying to correct that work. It's trying to keep blood glucose low, because blood glucose is a toxin. If we have too much glucose in the blood, it's a poison, and this is why insulin is elicited in order to pull that glucose out of the blood, store it in the liver and muscle as glycogen in order to save your life. This isn't there for athletic performance, and glycogen isn't the key for athletic performance also. That's probably a talk for another day. But this is why the body elicits that response. The primary response of insulin is to pull these amino acids from the proteins that we consume out of the blood and send those into the cell. This glucose response is a secondary thing, but this is what gets all of the airtime. But this is a natural response. We shouldn't fear the elicitation of insulin or cortisol. But if we do high intensity or endurance work for prolonged periods of time, this overexpresses cortisol. It impacts the HPA axis, which is the system involved with creating cortisol. Cortisol works as an anti-inflammatory. Cortisol actually increases glucose for its availability to use for energy. It suppresses insulin. It's an incredible compound with lots and lots of benefits when we use this in a natural, at a natural level, in a normal situation. If we run the treadmill for hours and hours each day, and I'm not telling each and any one of you to not to go running or to run a marathon or half marathon, so on and so forth, but if we overexpress this response, this breaks the negative feedback loop in the HPA axis, which is how we produce cortisol, and it sends a positive feedback, which sends cortisol into overdrive. And then when cortisol is elevated from overtraining, trying to lose this weight, you're actually telling the body to store fat. So this is why overtraining is absolutely counterintuitive. You can't outtrain a bad diet, and as Phil said earlier, the first double abs, the first abs that Phil has ever seen were in his mid-50s. This is because abs are made in the kitchen. We do this by managed insulin. We do this by consuming a natural, evolutionary appropriate diet, and we do this from consuming the foods that we've consumed our entire existence. And I don't know where Phil's gone now, but is he hiding? He's out the back.
Phil?
But we can get into the weeds with lots of other things if you wanted to. In fact, one of the things that I think and the two of us can probably jump in on this, is the misconception that vegetables contain lots of nutrients. So by a show of hands, I can hear you grinning there. By a show of hands, how many of us believe that vegetables contain vitamins and minerals at high volumes? Okay. Any one of you that have put your hands up, do you want to shout out to me a vitamin or mineral that you believe is in high quantity in vegetables? What are we consuming the veg for? Anybody? Vitamin A. Okay, which vegetable contains vitamin A? Carrot. It does not. Carrots. There's no vitamin A in a carrot. There's no vitamin A in any vegetable compound whatsoever. So what's found in vegetables and carrots is a compound called beta-carotene. So this is not vitamin A. True vitamin A is retinol, and beta-carotene is the plant version of vitamin A. So this is the compound that's found in plants. The human body needs retinol, which is found in animal proteins. And what happens is when we consume a plant compound, that beta-carotene needs to be acted upon by an enzyme called BCMO in order to convert it into the active form of retinol. But by doing so, it's depleted by over 20 times, making the amount converted close to zero. Animal proteins are abundant in retinol or vitamin A. So there's no vitamin A, just to reiterate, in vegetables. Anybody else?
Iron in spinach.
Sorry?
Iron in spinach.
Good shout. So do you want to jump in on this, or do you mean to? So there is iron in spinach, but it's not bioavailable. So that iron is bound to calcium within spinach. The body cannot obtain that iron. Red meat is incredibly high in heme iron, and this is the iron that the human body needs. Now, as a side, when it comes to spinach, we're told that spinach is incredibly nutrient dense. Spinach is a toxin to the body. And as you know by the book that you just held up, it contains a compound called oxalate. Oxalates break down into a compound called raphides, which are these little microscopic needles which we can see through light microscopy. The little needles that build up in joints, breast tissue, kidneys. They damage the thyroid, cause eyes, cause all sorts of issues. They bind tightly to calcium in the body, and they're the main contributing compound to kidney stones, amongst many cancers, thyroid cancer, so on and so forth. Now, this is how toxic spinach is. The average pack of spinach in the UK is sold in 200-gram pouches. So per 100 grams, and it does depend on which study or test that you look at, as many as 750 milligrams of oxalate have been found per 100 milligrams, which means that the average pack of spinach, or 8-pack of spinach, can contain as much as 1,500 milligrams of oxalate. So what does that mean? Well, 15,000 milligrams, so 15,000, 10 times that amount, will kill any one of us in a second. That's how toxic these oxalates are. Now, at the lower end, there have been recorded deaths with as little as 3,000 milligrams of oxalate, with 4,000 being quite predominant within many research papers that are accessible across the world. 3,000 to 4,000 milligrams of oxalates can kill you. Yet, each pack in the supermarket contains half of the amount that's able to kill you. Many other compounds contain oxalates which are damaging to the body also. When we consume these compounds, they are detoxed through a pathway in the liver called phase 2 detoxification. So phase 2 detoxification is a pathway that takes out toxins, and part of this process involves an enzyme called UDP, glucuronosyl transferase, and I'm going to test you all on that later. So, UDP, glucuronosyl transferase. So what happens when we consume this compound? UDP goes to work, it conjugates or binds to this toxin and excretes it from the body. Then when we consume black pepper or piperine, it blocks that enzyme, it blocks our body's ability to excrete that toxin. This is why we quite often see supplements that are sold with turmeric and black pepper together. Now, that's not to say that they're not beneficial. Plant compounds are medicines, and I believe that there is a benefit to consuming vegetables. Vegetables are there for medicinal purposes. So if we are sick, we take a medicine. But we shouldn't take medicine if we are not sick. We shouldn't take medicine if we're unwell. So these compounds are fantastic in the short term for combating things like inflammation in the short term. And we spoke about this recently, didn't we, in regards to the pathway that's activated when this happens. It activates a pathway called NF-κB, which elicits a response to NLRP3 inflammasome, which leads to this anti-inflammatory response. But this overexpression, as you mentioned during the podcast we recorded recently, will elicit this overexpression will elicit many other responses which lead to inflammatory cytokines, which will cause more issues later down the line. So medication or plants for these purposes are fantastic, but we shouldn't rely on them on a daily basis. And that's the issue when it comes to spinach. And we've gone off on a tangent with the eye in there, but have you got anything to add to that one?
Yeah, I mean, I think oxalates, it's not just that you have to look at what nutrients are in vegetables, it's also how do they limit your nutrient uptake in other areas too. I mean, one of the most famous studies on this topic was Nicholson 1979, where you may have heard of the experiment. I know you have. You probably know it word for word. But essentially, they gave some people oysters to eat because oysters have a high level of zinc. So you give the subjects oysters and you measure the serum level of zinc or their body's zinc level, and it goes up. Nothing spectacular there. But then they gave them the oysters with, I think it was kidney beans and or tortilla wraps. No zinc increase. So why is that? It's because there are anti-nutrients as well, and you have them in things like spinach. So these oxalic acids, I should say, to be chemically correct, form oxalate salts. And if you look at, for example, kidney stones, chemically speaking, what is a kidney stone? As a chemical, the majority of it is something called calcium oxalate. So it's oxalic acid, which you get in vegetables, combined with the elemental calcium. And so you get calcium oxalate. And that is something which we cannot process. It plays no part in human physiology. So what do we do? What does our body do? It tries to get rid of it using the detoxification that Richard spoke about. And so we try to get rid of it, but in so doing, we can't actually do it. Not all the time. And that's why it gets blocked up in places like the kidneys, and we get these stones forming, which is just the salt. It's just a macro version of that salt. It's no longer an individual molecule. It's a big stone that's visible on ultrasound because it's that big now, because we can't process it. So even if there are potentially some benefits, the negatives mean that we don't get those benefits. So there is no net benefit in any of them. And oxalate is a really great example, like in spinach that you said, because that is going to highly bind to things like iron and zinc and calcium, as you said. So we can't absorb them. So if you have a steak on its own, you will get those minerals. If you have a steak with some vegetables like spinach on the side, you may as well just not eat anything as far as those minerals are concerned, because you're not getting any of them. So there's not just a lack of nutrition in many aspects, like, for example, vitamin A, but there's a complete presence of anti-nutrition as well.
Yeah, spot on. That study that you mentioned is in my presentation tomorrow. Yeah.
Sneak peek.
Sneak peek, yeah. Fantastic presentation. But yeah, you're right. In regards to that, it's the phytic acid. So phytic acid is found in many compounds. Sorry.
Sorry, what about they claim that mushrooms have a relatively high level of vitamin D? How true is that?
You are the vitamin D expert.
So again, even if there is some vitamin D, which I think is questionable in terms of the amount that's in there, what about everything else that's in there? You know, there are, according to depends on which study you read, I guess there's always going to be some level of debate, but shall we say 100 carcinogens or more in mushrooms? So even if you get a small amount of vitamin D, what are you in a net positive or a net negative in terms of gain from that? I would argue you're in a net gain from that, because there are so many other bad things in there. In fact, I did an interview recently with a guy that I think some people in here know called Lee Copus. It was only last week, and he came down to my studio in London, and we sat down for about 3 hours talking about this. And even if there's vitamin D, can you get to it? Because this guy has lost his colon, and he's had it replaced with a colostomy bag. And we show the bag in the interview. He lifts his shirt up, and you can see it. And this guy has an absolute 100% factual, correct ability to see what a human digestive system can and can't process. And so he can do experiments every day. He just eats something and sees, is it digested when it comes out, or is it still whole? And I know it's disgusting, I'm sorry. That got to have eaten already, most of us. But he said to me, if I was to take any vegetable and cut it into a particular shape, like a triangle, and eat it, it would still be in a triangle when it came out of me. And so one day he had a mushroom, I can't remember which one, and the mushroom came out pretty much whole. So even if there's vitamin D inside, can we actually take it from it? What are the negative things are we getting from it? And how is it messing up our digestive system such that it limits our ability to absorb nutrients from everything else that's on the plate? And what kind of damage is it doing to the digestive system directly if it can't be broken down? Because it's going to have fiber in there as well, which is completely contraindicated in the human diet.
Lee, by the way, is an ex-vegan, now turned carnivore, so lost his calling through being a vegan for many years. So a big advocate of the vegan lifestyle, not to give too much away from the interview.
It's a good
but
effort.
Vitamin D, do you know what else is high in vitamin D? The sun and animal proteins.
Yeah.
But the interesting thing, and you can go into way too more detail than I can with this, that vitamin D is quite often a surrogate marker of being healthy. So we will supplement with vitamin, and I'm not against vitamin D supplements at all, by the way. I think there's a place for them. But much of the vitamin D levels that we see in the body are a result of being metabolically healthy. So when we're metabolically healthy, we have higher vitamin D levels. We can't become metabolically healthy by adding in vitamin D. So much of the vitamin D that we get, as you say, is synthesized from the sun. UVB hits the skin. The vitamin D is activated as a sunscreen to protect you from the sun and allow you to achieve all of those net gains from what the sun can benefit. The benefits that we see from the improvements in health and well-being don't actually come from the vitamin D themselves in this respect. It comes from the increase in nitric oxide. So the UVB hits the skin, this increases nitric oxide. Nitric oxide is a potent vasodilator directly correlated with longevity, which is something this man knows all about, being a longevity doctor. So this is why this is why it pays to be in the sun as nature intended. But animal proteins, incredibly high in vitamin D. There's no vitamin D in vegetables, by the way. No vitamin D. B vitamins also incredibly low. Cobalamin and vitamin B12, which is essential for neurotransmitter production and the production of methylation, is not found in vegetables. Vitamin B1, B2, niacin, B3, trace amounts at best. Pyridoxine, B6, incredibly low. The only B vitamin that is found predominantly in vegetables is folate, but we can get all of this and more from animal proteins, particularly from eggs. Vitamin C was a question that somebody asked me earlier today. Let's look at compounds that contain vitamin C. Kale, incredibly high in vitamin C. Now, kale also contains compounds called flavonoids. Flavonoids are endocrine disruptors, and they also they block the absorption of vitamin C, basically, meaning the amount of vitamin C found in kale, once we consume it, is actually blocked by these flavonoids. Flavonoids are also an endocrine disruptor that affects our ability to create thyroid hormone, and that's probably a talk for another day. But very little, we can go off for hours with this, very little vitamin C found in kale and citrus fruits and so on and so forth. Animal proteins, despite common belief, do contain vitamin C. A piece of beef liver, for example, will contain 24 to 25 milligrams. And I understand that many won't eat beef liver, but it's also found in beef. A 12-ounce beef steak contains around 12 milligrams. Now, these numbers sound low, but the interesting thing with vitamin C is that it activates, or it accesses the cell through the GLUT4 transporter. This is the same gate or transporter, if you like, that glucose needs to activate or access. So when we reduce carbohydrate, there's less competition for the vitamin C. So the less carbohydrate we consume, the more vitamin C that the body absorbs. This is why we can obtain all of the vitamin C that we need from animal proteins. I've been living this lifestyle for over a decade, and I'm still yet to suffer with scurvy. So vitamin D, as we've already spoken about, is found in high capacities within animal proteins. Vitamin E also. Vitamin K. If you go to your supermarket and pick up a pack of kale, there is a stamp on there that says high in vitamin K. Do you know how much vitamin K is actually found in kale? 0. The human body needs vitamin K2. Kale contains vitamin K1. And in order for us to get that K2 again, we need to convert K1 into K2. So there's no bioavailable vitamin K in kale. So again, it's nothing more than a marketing ploy. And then we have things like creatine, carnosine, carnitine, and choline. All of these things that are essential for many functions within the body are all found in animal proteins. So a piece of beef, piece of animal protein, quite literally contains every single vitamin and mineral that we need, not just to survive, but thrive. There is absolutely nothing that we need from vegetables. And I'm going to go into more detail in regards to this tomorrow, so I'm going to shut up for a second and let the questions come in. But animal proteins contain quite literally everything that we need. Fiber, if you want me to go into that really quickly, Phil. I did say that you couldn't shut me up. So look, fibre is the next, and I will keep this really quickly, but how many of us think that fibre is important? Don't be shy, you can put your hands up. I don't mind. There we are, a few hands. Brilliant. So what we are told that we need fibre for is primarily for butyrate. So we consume plant compounds. It breaks down into a short-chain fatty acid called butyrate. That butyrate binds to the colonocytes in the gut, and then it further breaks down into beta-hydroxybutyrate. So this is the benefit, and it does do this, and it is beneficial to the gut in that form. Now, what I just said there is that butyrate breaks down into beta-hydroxybutyrate. When we are ketogenic and carnivore, we produce ketones in the form of beta-hydroxybutyrate. This beta-hydroxybutyrate runs through our veins, and it feeds every single colonocyte in the gut, not just the ones that this butyrate comes in contact with. So our requirement for fibre is non-existent. But let's pretend that we're not producing ketones, we're low carb, we're not producing ketones. Animal proteins contain short-chain fatty acids also in the form of isobutyrate, valerate, and propionate, which are the same type of short-chain fatty acids which break down and feed every colonocyte in the gut. What that means in simple terms is animal protein contains animal fibre. Everything that you think you're consuming plant fibre for, we can get from animal proteins. There's quite literally nothing that we need from a plant. These plants are nothing more than survival foods. We only would have consumed them when we didn't have any animal proteins available. And that was pretty quick for me.
That's extraordinary. Can I ask a question? I've been told to take a sulfur MSM supplement, but they said to me as well that I had to take vitamin C with it. Do you know about this?
That's the one you can get into deeper, I guess.
I mean, what are they telling you? What's the reasoning they've given you to take the MSM?
Well, they just said it's for detoxification.
Okay, so MSM, methyl sulfonol methane. If they're telling you to take it for detoxification, I would completely disagree. There may be some benefit in detox, but if you're carnivore, you're going to detox anyway. And when they're telling you to take vitamin C, like Richard said, it's a relative nutrient. Okay, what that means is, even if you have vitamin C in the plate of food that's in front of you, it doesn't mean your vitamin C level will go up. Chemically, without being too complex, if you could see a molecule of vitamin C, see that ring of carbons with all the hydrogen and oxygen around it, you had that there, then you had glucose with its ring of carbons and the hydrogen and oxygen around it. They look very, very similar. Okay, there's not a huge amount of difference. That's why glucose and vitamin C go through the same door into the cell called GLUT4. Vitamin C also goes in through GLUT1 and GLUT3, depending on which part of the body you're talking about. And it also uses another door called SVCT, sodium-dependent vitamin C transporter. But because vitamin C and glucose look very, very similar, one of them will always win the war when it comes to going in through the door. One of them is always stronger. And the reason is because when we look at a molecule on a really, really, basically a quantum scale, without being too complex, you have a distribution of positive and negative electrical charges based on all the atoms that are there. And based on that, which is unique for every molecule, which is why we would give every molecule a different name, one will always have more affinity, more attraction to something than another. Glucose has a higher attraction to going in through the door into the cell, the GLUT4 door, than vitamin C. So if your meal has vitamin C and carbohydrates together, the glucose that all those carbohydrates break down into will always 100% of the time beat vitamin C into that GLUT4 entry into the cell. Every single time. Now, some vitamin C will still get in because there's GLUT1, GLUT3, and SVCT1, SVCT2. But again, that depends on which type of vitamin C you have. So you still cannot guarantee that any of it will actually get to where you need. So if they're saying that to you that you need to have vitamin C, it doesn't mean you need a vitamin C supplement. Chances are vitamin C is already in the food that you're eating. But it could be that you're eating it with carbohydrates together, which is why there's competition between the glucose and the vitamin C to get in, and none of the vitamin C is getting in. So even if you take a supplement, that's not addressing the root cause. A supplement, they might tell you, or take a supplement. But if they didn't tell you, take that supplement separate to carbohydrates, it's completely useless. I've seen people, even that I work with, who are having a meal and they think vitamin C is really cool and good and you've just got to have it, they'll have their meal and then they'll have a dissolvable vitamin C tablet. And what are you wasting your time for? You've had a meal with carbohydrates there. None of this vitamin C is now going to enter the cell because it's in competition. So for detox, I think you're in the right community to understand what the right diet is. For vitamin C, again, same thing. You don't necessarily need a supplement. You need less competition for vitamin C to enter the cell.
Yeah, but what, like the MSM supplement, did you not recommend having that at all?
No. I mean, MSM has a place. I mean, some people take it for skin and everything, but if you eat this particular way that we are all here for today, there's no physiological requirement to take an MSM supplement at all. I don't know if you want to add anything to that, Richard?
Can I come up, sir?
Yeah. This is Coach Stephen. He's trained probably 4 figures number of people into going carnivore.
Can I just add something that we don't talk about much? Hi. I just want to talk about studies, the design of studies and the outcome of studies, because we have to look at what the results are, but what was the design and what were the limitations, and we don't talk about limitations very much, and a couple of things have come up, and we take vitamin D for example. When we now do studies, there is an ethical element. There are most people that will benefit from supplementation or going out in the sun for vitamin D. If you are insufficient, they are not allowed to keep you insufficient. So the only people that can be in those tests and in the studies have to be sufficient. And the logic, and it makes total sense, is if they know you're insufficient in vitamin D, then they have to supplement you, and they can't put you in the other group, which is on a placebo, because that's not ethical. Because if those insufficient people had problems, firstly, they could sue, certainly in America, if they found out they were the insufficient group and they were putting the placebo section and didn't get vitamin D, and they'd had some terrible outcomes. So you have to look at the headlines when people say XYZ supplement doesn't work. You have to find out how was it designed, who was excluded, and why were they excluded. So I had this when I started rehab, about 15, not my own rehab, but giving rehab to people. We were looking at glucosamine as a supplement, and anecdotally it did very well, but studies always showed it didn't. And I dug into that and found out that when they do the studies, they have to have an image which shows a problem, so they can categorically say this intervention got rid of this problem. And many of the people that were helped with glucosamine didn't have a fracture, they didn't have something you could see on an image, but they had a joint pain, like shoulder pain, knee pain, or whatever. So they would not be included in the studies. And I think that's one of the things that we need to talk about a lot more, is not just the conclusions, but how did they get to those conclusions? Because I think we all probably know someone that's told, have this supplement for 6 months and it's going to cure everything. Maybe it didn't, and you know, Abs and Richard talk about things that confound that result. They're giving the supplement but not changing the other thing, like with vitamin C, as you were saying, or like with oxalic acid, having a problem there. So I think that's one of the things I want to. I'm going to be talking about vitamin D tomorrow a little bit. I won't actually talk about that, but obviously when you're doing presentations, you get into studies, and there were tons of studies I could have shown you, and actually said, look at this study. It says this vitamin D supplement didn't work, but it didn't work because everybody that was giving it was already sufficient in vitamin D, so you wouldn't get a good result from it. So I just wanted to add that.
Perfect. Fantastic. Okay.
Can I ask a question again? Sorry. I read something not so long ago that there are 14 types of D3 hormone in our bodies, and actually what we're measuring is the inactive one, which is actually useless because the inactive one is only there when we're sick. I just wonder what your thoughts are on that.
25 hydroxyvitamin D.
Could I just?
So,
I can't hear because there's no microphone. So what is the question?
So the vitamin D, most of the vitamin D within the body is inactive.
The one that we're measuring, because
The one that we measure.
Oh, right, okay. What do we measure? Right, okay. Well, actually, the best measure is 25 hydroxy. because
And that's the inactive.
that is the inactive form. When you do study the active form, you get some. I mean, I did bloods for over a decade. You get some confounding results, and then you find out it's because of a parathyroid hormone issue, actually. So when you test the active form, you tend to find it's normal or elevated, and it does reveal other things, obviously. But to get a baseline comparable to other people, so you can know where you're starting. If you do 25 hydroxy cholesterol, then that is about the best measure. The thing is, because what we're looking at, and I hate normative ranges, but it gives you the best idea where everyone is in comparison to everybody else. And vitamin D really is a hormone rather than a vitamin, I suppose, is very different to everything else. Completely different, because sunlight, it's one of the few things that are activated, or the beginning of the activation starts without any enzymes. It's just light and heat. So it is a really good indicator of what you're doing, whether you're going outdoors, whether you're getting light, whether you're getting the right amount of heat, and overall health. And I know Rich and I may be slightly different on this, but in the end we are the same. It isn't the be-all and end-all of health. You could supplement and supplement till the cows come home, but if you're not eating enough fat, for instance, then you would not get the benefits, because obviously it's one of the cofactors is it's a fat-soluble vitamin. There's a lot more to it than that, but you do need to have it with fat. That's one of the things. Interestingly, in the 70s, they used to give a different form of vitamin D as a supplement, which was able to go to the portal system rather than the lymphatic system, so you were taking the fat element out of it. And it was really successful, hence it was taken off the market, because it was doing too well. Actually, I think one of the countries, I think it's Australia and New Zealand, are actually thinking about bringing it back. Believe it or not, those countries are very hot for about 6 months with lots of sunshine. So, that is the best measure. But if you're looking at your vitamin D status and you want to know, do I need to supplement? Actually, there's other things you need to look at. Sorry, do you want us to wrap up?
Huh?
Oh.
Well, no.
Oh, right, come on.
I'm not coming up. He's giving me the mic. Like he's so well behaved. He's just so polite. It's like you can have that. I'm not going to come up and compete with these buggers. Jesus. Listen, guys, it's just amazing. Just carry on and whatever, and have a few questions. But there's stuff we got to do on the stage. Also, that fire pit's going out there. If anybody's got any meat they want to cook on it, and remember, these guys are out there now. Go and chat with them or whatever. Don't let them steal all their thunder, because they won't stop. And they won't stop because they're so passionate about this stuff, because it works, and the amazing things that we see. So, guys, see if you can catch them out there. Obviously, speak for a little bit more, but not too much, because we've got to do that. And I want to keep your stuff for tomorrow, and they're here, so you can go chat to them, right?
Should we take like one or two questions, Phil, and then you can get on the stage?
Yeah.
Yeah, I think you did a nod. Any other questions from anyone at all about anything? Life, mortgages, knee pain?
Okay, sorry.
Yeah.
Sorry to call. Cholecalciferol, it's D3. I've heard that it's actually quite toxic for us. What are your thoughts?
Stephen, so the question was cholecalciferol.
Calciferol, yeah.
She said cholecalciferol is potentially quite toxic.
Is it?
I don't know if you want to talk about that.
Cholecalciferol. Why? Well, I don't think that is.
I heard that was the form of D3 supplementation.
She said she heard that was the form of D3 supplementation, and that it could be potentially toxic.
Right. Okay. Vitamin D toxicity is possibly the rarest medical condition in the world, and most symptoms of alleged vitamin D toxicity are actually magnesium deficiency. There's a couple of other things. I am actually getting into the realms of my talk tomorrow, so I don't want to spoil it too much.
I'll just share something with you in terms of the toxicity. I agree with Stephen. I think most of us, sitting up here would all agree. Currently, the guidelines for vitamin D, if I'm not mistaken, I think are in the range of 400 to 800 a day, something along those lines. And if you go well beyond that, into maybe a few thousand or several thousand, maybe a little bit more, they class it as potentially toxic. I took 100,000 for 3 years, 4 years, maybe more. There is a video of it on my YouTube where I show you exactly why it didn't cause any toxicity. And the reason they say it's toxic is because it raises your calcium level too high in your blood to give you something called hypercalcemia. Now, my D3 level is in the toxic range. And I took a blood test for that to show everyone. And then in the same blood test was my calcium, perfectly normal. And the reason is because D3 is not something that directly dictates how everything works in the body. It is something which is linked to other things that then have knock-on effects. It's just information. So when you're in your car and you're driving along, you can have the temperature gauge tell you it's boiling hot or freezing cold outside. Doesn't mean you do anything. It's just information, and you take that information, you turn the aircon off or you turn it on or whatever. D3 is the same thing. It's just telling you the sun is out, essentially. And then that then causes other processes to happen. Those processes require things like magnesium, as Stephen said. And so too much of the D3, or a high amount of D3, means you must therefore have a high amount of magnesium for it to have a relative knock-on effect to be used. So if you don't have enough of that thing it's calling on, that's why too much of this is the same as too little of that, because one calls on the other.
Not enough K2 is another.
Yeah, absolutely,
factor.
absolutely. That's why my calcium level never went above normal.
The thing is, what is vitamin D3 actually doing? Well, it's talking to your genes. That's yeah. So Dr. Hollick is the guy basically that has unravelled the entire process from sunlight to actually getting into your bones and coming back out and doing some other things. I mean, he's the leading authority. And when he talks about vitamin D toxicity, yeah, there are some conditions where you can't supplement. I think tuberculosis being one, but that's to do with the signalling from the bone, which makes sense when we talk about K2. He was saying that he personally would not expect to see someone toxic, and this is him saying it, I've actually seen it, it's not apocryphal, if they took 100,000 IUs every day for a year, he still doubts they would be toxic in vitamin D3.
Or 4 years.
Sorry?
Or 4 years.
Yeah. So you've also got to look at it in relation to the study from Finland, which is 62 degrees north. It's not particularly hot. A 30-minute sunbathing session there will produce between 10 to 20,000 IUs of D3. So if the body can take that amount of processing from just light and heat and make that amount of D3, I think taking 6,000 IUs is easily capable. The body is easily capable of taking that amount. One thing that's come from this is I am really glad that I picked D3 as my presentation. I will do the thing about stable isotope testing. And are you here tomorrow? Yeah. I will go through absolutely everything that it might put any worries you've got to one side. But I also want to talk about some of the other things that are cofactors, like the production of osteocalcium, which is really important. K2 is really important because that helps the calcium get to where it should go. You've got matrix, the GLA protein, which also needs K2 to stop it getting into the soft tissues. But now, I mean, the latest research is really fascinating because I don't want to get too geeky. He likes it. But you get this thing coming out of your bone now, they've discovered, called under-carboxylated osteocalcin, which has a huge effect as it comes out of the bone and is quite revolutionary in its treatment for things like diabetes and blood pressure. It has huge knock-on effects which are really good. And maybe every single cell, every single tissue, I should say, or region of the body has vitamin D receptors. It is the oldest hormone that we know from animals. We absolutely know that. So it's been around a long time. It's not just in humans. Vitamin D is really a hormone. It signals, when we look at gene expression, which is, again, vitally important because the genes are the things that make the proteins that you need. If we just use one of the things, if you take 600 IUs, and they've looked at this when they've done bloods, and they've looked at the white blood cell formation, you can then reverse engineer, and you can look at what genes have been expressed to make the things in the blood. If you take 600 IUs of vitamin D3, it's upregulated and downregulated some genes about 150 times. When you've done it with 4,000 IUs, it's something in the region like 300 to 400 genes have been upregulated down or up. 10,000 IUs, and it's something like 6,000 or 3,000. It's something like that. It's really huge amount of work on gene expression. And that to me shows that, wow, the more you have, the more it can do. And going back to the studies, a lot of the studies are pitiful because they have not given sufficient dosage. So going back to the ethical question, the people that really need it cannot be put into the study, and they're actually taken to one side and treated, which is purely ethical, and I totally get that. So the people that really need it, where you would see spectacular results, I think, in the trials, can't even be part of it. And I just feel that I'm quite passionate about it, and you're right, Phil. I was reluctant to get up, but it is a big topic, and I will cover it tomorrow in a bit more detail. There you go, Rich. I'll shut up now.
Fantastic, and I think there was
One final question, I think, with the lady in the pink.
Oh yeah, I just meant to ask, what do you think of amalgam fillings? And if you think they're bad, what's the best way of getting them out?
Sprechen Sie Deutsch? Ja? Wo kommst du auf Deutschland? Österreich. Sorry, thank you. Ich lerne erst seit 8 Wochen. So the question was about amalgam. Amalgam is just a technical term for when different things come together and mix up. So in layman's terms, it's the metal fillings that you have in your teeth. The controversy is surrounding the fact that one of the metals in this alloy is mercury. And before I answer, let me just tell you what your dentist will have been taught in dental school. We are taught that there is absolutely nothing to worry about doing this. We are taught that mercury, yes, is poisonous, but amalgam in the form of a restoration, which is a technical term for a filling, is not the same as mercury. And it is, to put it in a pun, it is drilled into us that it is perfectly safe. If a patient says to you they are worried, then you should just allay their fears and do it anyway, because there's nothing wrong with it, and you need to show them there's nothing wrong with it. We are told, if a patient says to you that, what about Sweden that has outlawed amalgam fillings or banned amalgam fillings, then what we should say to the patient is, well, that's happened because of environmental concerns, because of the disposal of these fillings, rather than what it's doing to the individual. I won't give my thoughts because I don't think I'm allowed to swear on stage.
Of course you are.
But can I? Okay. I think it's bullshit, frankly. But essentially, when you are putting these things in, the moment the filling goes in your mouth, and you look at that filling, it is in one particular position, it is one particular size, the edges are meeting the tooth, etc., etc., etc. As time goes by, it will never be the same. As time goes by, the edges will wear away. As time goes by, it will slightly chip off. As time goes by, some of those alloys may come away. I don't know whether or not that is enough to cause any acute symptoms. I've never read papers specifically about that. But what if you end up swallowing little pieces? What if some of the food you eat contains acids, which then cause the dissolution of some of those metals in the alloy? I don't know. And it's certainly for me, it is not a risk that I would ever be willing to take. Now, in terms of the mercury, when you take the filling out, I believe from what I have read, which is not everything, I'll be honest, there is a risk that mercury could come into the atmosphere. Now, if I remember correctly, I was taught, and even dental students now will be taught, that it is temporary and it is not going to have any lasting symptoms. Does that excuse it? I don't think so, personally. If you are going to have these removed, what you need to ask for is something called a rubber dam, D-A-M. Think of a rubber sheet, okay, like pretend my hand is made out of rubber, and imagine a hole right in the middle of that. And that one hole is stretched over the tooth. Just like when you put a jumper on, your head goes through the hole, your head pops out, but the jumper is on the rest of you. So what happens is that rubber sheet is stretched over the tooth, and you're sat there with this kind of rubber sheet over your mouth with just the tooth poking through. If the filling is removed under rubber dam, there is no way that gas, if any gas or debris or material, can actually go inside your esophagus at that point, because there's a complete rubber sheet in the way. Once you take it out that way, it's much, much safer, in my opinion, to do. That doesn't mean you should go to these biological dentists that are popping up everywhere, because that's a load of BS as well. It's just dentistry with a fancy word stuck in front. What they're doing is exactly the same as what your regular dentist is doing, but they may be using social media more and more buzzwords, but it's exactly the same. Now, if you take it out, there are certain risks involved. For example, to take out all the amalgam, you have to take that out and you have to remove some of your own tooth material. That's the only way you can absolutely guarantee that everything is out. I'm not talking a lot, just a hairline amount, just a little brush with the handpiece, with the drill, just to clear everything out. But you are losing some tooth material. And so your tooth is technically, potentially going to be weaker afterwards. Your tooth may suffer from some level of sensitivity afterwards. When you have an amalgam filling as well, the edge, okay, so what in dental terms is called the margin. The filling on your tooth meets the enamel or the dentine, and where that border is called the margin. That margin undergoes leakage because an amalgam filling does not chemically bond to your tooth. The way it's held in place is you cut that hole, and you might imagine in your head as you go in and you go across and you come up, you've got this hole with vertical walls. If that was what was holding your amalgam filling in, it will just fall out because there's no chemical bond. And it just goes in and it comes back out. That's why it's mixed. It's almost a paste when it goes in. The dentist will drill the hole to get rid of all the decay. The walls may be vertical, but then they undercut the wall, so they dig inwards. So instead of the wall being vertical, it's slightly inwards like this. So any material is locked in the undercut and it prevents it from coming out. So they put the amalgam in inside, spread it around, build it up, and then it sets. If you're going to do that, you have structurally undermined that tooth, the same as if you're building a building. And so what happens is you take the amalgam out, but the sides of the cavity are undercut like this on either side. And so you have to take out the bit where my hand is, and the wall suddenly becomes vertical like this, so you can actually put your filling material, because white filling material has a chemical bond. You don't have to shape the cavity to lock it in underneath. So what does that mean? It means you're losing even more tooth tissue because the cavity wall might be caved in to lock in what's inside. You're taking out this section here where my hand is to bring it like this. So all this thickness here of enamel is now lost. Your tooth has now been structurally undermined even more. And so it's at more risk of fracture. Even if you keep it clean and decay-free and gum disease-free, great. But the force going through into the tooth is now much more likely to break it. Our teeth can withstand incredible forces. This mastication system here is the highest force generated by any muscular system in the entire body. And it is all going through your teeth. They are incredibly strong, strong things. They are the strongest example of biomineralization in all of nature. But that's an intact tooth. If it's had a big hole drilled out, even if it's replaced by filling material, that enamel on one side of the tooth is no longer connected to the other side because there's material in between. And that margin where they connect is where force concentrates. And that is where fractures start to happen. So you go down a downward spiral. So yes, you may think replacing amalgams is a good idea because it looks better, or you don't want this nasty material in your mouth, fine. But what about the higher risk of fracture, which then sends you down a downward spiral, which may never have happened if you never took it out in the first place? Now, I'm not one for amalgam fillings. I'm not defending them in any way. But I'm here to present both sides of the argument. My advice to you as someone who's been there and done it for many years is if it is not causing you any problems and you have no symptomology, don't force it. If you have an issue, yes, remove it and do the best you can. Consider a crown rather than a filling to protect the tooth long term. But that is on an individual basis, and you've got to discuss that with your dentist. Have your regular checkup, and your checkup is not just about taking x-rays, because an x-ray is useless if you've got an amalgam filling. You can have decay on one side of a tooth, but there's a metal filling going through that tooth, so when an x-ray goes through, it can't see the decay anyway, so it's hidden. So on an amalgamated tooth or a tooth with an amalgam filling, you're relying on the dentist's eyes to tell you whether it needs anything else or not. So assuming you've got a good dentist that is keen, that is able to look at that and be really, really pernickety, even if it's a tiny little thing, and they say, I reckon I'm removing this, that's not a sales technique, that's a safety technique. Because even a tiny, tiny, tiny hole that he can just about fit his probe into is as wide as the Grand Canyon for bacteria. So you must listen when they say there's a slight crack in it, and you don't go, oh, it's only a small one, I'll be fine. No, it's too late. You've got to get that removed. So if you have nothing wrong with it, my advice potentially is to leave it. On an individual basis, I might change that. I can't see your teeth, obviously. But if it is causing you an issue, get rid of all of it, put a white filling in the middle, and then depending on how big the filling is, I would probably just crown it straight away to protect it long term. If you put a white filling after replacing a silver filling, you've got to, I'm going to try and, it's hard without a screen, but just try and think of this with me. Imagine a 3D tooth, and the middle of it is hollowed out like an ice cream scoop. You've got enamel all around the outside and a hole in the middle. You can put material in that hole, but now there's a margin where both materials connect, which is where stress is going to concentrate. If that tooth breaks, and it is likely to for reasons which are too complicated to go into right now, without the diagram especially, then that means the outer enamel is going to come away. And if you don't have that, and the filling goes, well, what the hell are you going to put a crown on in the future? So you're better off getting the amalgam out if there's a problem, putting a white filling in, and if it's a large filling, protecting it with a crown straight away, and hoping you'll be symptom-free for the next 10, 20, 30 years. Tips for doing that: number one, don't go NHS. Not that the dentists are terrible, but because I was in the NHS. I'm not kidding when I say I paid to go to work on some days. It cost me more money to treat my patients than I was making. I had to leave. And I'm telling you now, the reason dentists go private isn't because they're power hungry or greedy, it's because many of them are in that position. You may find that hard to believe, but I promise you, I was there, I lived it, and I had to leave. So don't go NHS. Number two, always ask for a rubber dam if you're going to have this silver removed. Number three, always have the conversation of protecting it with a crown straight away instead of just leaving it at a white filling. You can leave it at a white filling and it will look fine the day you leave. But what about that fracture risk that then costs you multiple times more in the future? Because now, even if you want to put a crown on, it's fractured so much there's not enough material left to put a crown onto. So get it right the first time and don't be afraid to spend your cash. If it's expensive, look at finance options, because that's cheaper than paying the cheap option, having more fractures, and then not even being able to put a crown on it in the future, and having things that get much, much worse. I hope that answers your question in a very long-winded way. Dankeschön.
Brilliant. Thanks to these guys. That was an impromptu one and just couldn't waste it. It was fantastic. Just Ro, if you're still within earshot about the MSM, I have an interesting thing about that Jack Cruz said, that not specifically MSM, but osteoarthritis can quite often be the body robbing the cartilage of sulfur. The body stores quite a lot of sulfur in the cartilage, and if you know, the general thing, if people have tweaked that, which many people haven't, you never hear that from a doctor, but you only hear it from people like Jack Cruz. But if it then wears down, you can regrow it, and MSM is often prescribed for that or suggested because it's methyl sulfonyl But why not stop the foods that stop the sulfur uptake in the first place? Subtraction is always the best thing. So that's something to think about if anybody's got osteoarthritis. Yes, you can grow back the cartilage in a lot of circumstances. And I've seen, you know, carnivore people, people going carnivore having tremendous results with that, not just the inflammation, but actually the regrowing of the cartilage. As long as it's not too far gone, absolutely bone to bone and whatever, but they probably say bone to bone half the time when it's not, just to scare people into an operation and putting cybernetics inside you. But anyway, guys, thank you. Amazing. Thank you so much, Abs. Thank you, Richard. Thank you, Stephen. Okay, guys, there's a fire pit out there. There's a grill on the top. If anyone's got any meat, go out, cook it. It's really nice. I was the first one to cook on there and go. Yeah.
When you cook the meat, How far do you go before you destroy the benefits of the meat?
Oh God, that's a huge question. Grab one of these guys and talk about it. There's still a hell of a lot more nutrients in burnt meat than there is in any vegetable. We burn meat for millennia, probably over fires. It's fine mostly, as long as it's not all the way through. But yeah, so there will actually be a bar for those who like to enjoy that sort of thing, and that will be open about 7 o'clock in here. And yeah, we'll do some music soon, but chill out, go and eat and hang out. We'll let you know when it's come back in. Stephen, Richard and Abs, thank you so much.